Good morning and welcome to Conversations in Care on the Third Planet Network. Today I am talking to Cheryl Lockwood. She is a community planner for 4 counties in Illinois: DuPage, Will, Grundy, and Kankakee. And hopefully I got all 4 of those. She's working at the Area Agency of Aging. And what we're going to be talking about today is Medicare fraud. So what an interesting topic this is. Welcome to the show, Cheryl.
Well, thank you. I'm pleased to be here.
You know, I think this is such an interesting topic, but I think one of the things about this topic is we really don't know much about it. I think we know that it's there, but we really don't know much more than that. So I was hoping before we dive into what we're going to talk about with Medicare, maybe you can tell us a little bit about your background first and what you do for age options in Will, DuPage, Grundy, and Kankakee counties.
Well, as a community planner with the Northeastern Illinois Agency on Aging, I serve a 4-county area as a community planner and actually cover an additional county for the Senior Medicare Patrol program. Now, the 4 counties that are represented as a community planner are Kendall, Will, Grundy, and Kankakee counties. However, with the Senior Medicare Patrol program, I also add DuPage County to that particular area. Along with being a community planner, that means I do public relations with senior providers in each of the counties that I serve. I also do the Ombudsman program for the 8-county area for the Agency on Aging, and that's a program to assist seniors that are in long-term care facilities or assisted living facilities to have an outside representative that it's objective to represent their rights within nursing homes and assisted living facilities. And the Senior Medicare Patrol is just another hat that I wear as a community planner. The Senior Medicare Patrol program is a program that recognizes the fact that seniors are the ones to best spot Medicare fraud. Because they're the ones that see the billings and all of the things that come through for their Medicare. But I don't think they realize how much power they have within that particular area, because that's where it actually gets tracked from, is from the billings that come through Medicare. And a huge amount of money is lost every year to fraud. In regular healthcare fraud, there is a loss of between $75 to $250 billion lost a year. That includes private insurance, Medicaid, Medicare, all of the insurance programs. They figure that at least 6 to 10% of billings within healthcare is fraud. And in Medicare alone, at least $19 billion of that is through Medicare. And obviously, we don't want to lose that money when we want to keep Medicare around for a long time for future generations.
Right, absolutely. And I think this is, all of this is extremely interesting. And I'm amazed that you even have a few minutes to spend with us because you're so busy. But I think this is such an important topic because I think it's interesting because I think it's important for us to look at, one, who's affected by the fraud, and then we'll kind of go through, after we talk about who's affected by fraud, we'll kind of go through all those different things like you said. How do we detect it? How do we report it? All of those things that are really important for seniors and maybe even their family members to understand a little bit more in depthly. So why don't we start there with who is actually affected by fraud, by Medicare fraud?
Well, obviously, seniors that are on Medicare are affected by that. There's always talk about Medicare being a program that costs the government too much money. And so any loss due to fraud is certainly a big loss to seniors as far as the program is concerned, because it means that their money is being used less effectively. Not only that, but Medicare fraud can mean that seniors receive a loss of benefits. It means that their premiums will be higher for their supplemental plans. It can basically be an identity theft problem as well, too, if someone steals their Medicare number, because that's their Social Security number as well. So it definitely impacts seniors as far as it goes. But of course, it impacts all of us, because all of us are taxpayers. And so we don't want to see waste occur at all as taxpayers. It's our money that they're stealing. So it's very imperative that we recognize that don't be some people lack concern when they say, well, it's just my insurance company will pay for it, so I'm not losing money. You are definitely using money within the Medicare program if there's fraud going on.
And Cheryl, I was wondering, I think it might help some of us, whether it is someone, a senior that has Medicare, or it's maybe one of their loved ones, a family member, working through some of this stuff. Maybe you can give us a few examples of what Medicare fraud actually is. I don't know, maybe like through whether it's a home care service, a physician, durable medical equipment. If you could share some of those examples for us so we can understand it just a little bit better.
Absolutely. And first of all, I just wanted to say, I don't want people to think that everything is fraud out there, because there are many good providers out there that provide excellent services to seniors and the disabled, by the way, who also get Medicare, who are under age 60. And so there are many good people out there, but fraud, true fraud, is actually a crime. It is very, very specific in that it has an intent to steal money from the program. So true fraud is a program that is actually, there is intent involved. And there are some cases to where there will be mistakes made, which is clear on the other end of the spectrum. It might just be waste. It might be a coding error or data entry error or something such as that. So I don't want people to think that everything that they see on their billing could be fraud. It's not necessarily true. It behooves us to know who your providers are, know what looks right, and all of that. But Medicare fraud can take many different types of things. To give you an example of home health care fraud, this is an example from Illinois. There was a person that had someone knock on their door. There was a nurse at the door. It was from a home health care agency, and they wanted to let them know that their doctor had sent them because they wanted them to provide services to them by coming to their home and taking their blood pressure on a weekly basis. Well, the person didn't question this, and what happened is a nurse started billing Medicare through their home health care agency for skilled nursing services. Now, first of all, a lot of us have our own blood pressure cuffs, so that is not technically a skilled service. And secondly, it is very unlikely her doctor sent a home health care agency to her door without informing her. So some of it's common sense and knowing something just doesn't sound quite right when it comes to the circumstances. In this case, the home health care agency billed for skilled services of a nurse, which doesn't necessarily take a nurse to take blood pressure as well either, for these particular services. And so that was a case of Medicare fraud as it relates to the program. Another example might be when there's any kinds of billing for services or supplies that aren't provided. That's why it is very, very important for people to look at their Medicare billing. Sometimes I think a lot of people put that off because it can kind of be a little overwhelming. But the fact of the matter is they're the only ones going to know whether they received the service or not. And if they're uncertain whether they did or not, they should call the provider and ask about it as well, too. It can be billing for services supplies that are different than what was actually provided. In other words, it could be something that they sent one item, but they billed for a higher priced item or something that was not they received. It can be changing forms or coding very specifically to get higher payments for things. Example of this might be there was a podiatrist who went to a senior retirement home and cut toenails, and he billed Medicare as if it were an office visit, which it wasn't, and then he called it surgery. So those are kind of examples of what actually can be a fraud situation, and that was very specific to that particular case. It could be billing multiple times for some of the same services or things. It does happen sometimes where something gets billed due to data entry error. So that's why we always tell people to contact the provider first to verify. And then if it still doesn't make sense, there is a number you can call to actually report and ask if it might be a fraud case. So we're not expecting people to be experts about what is fraud. But there is a state grant with age options that they can call, and that's all they do is Medicare fraud. They don't call the Medicare number because we know how long the lines are and all the questions. They can do a lot less than age options at this number can be contacted, because that's what their grant is for, is very specific to reporting Medicare fraud. And they do have an 800 number, which I can give to you now. It is 800-699-9043, and it is toll free, and you can call and talk to people who know about Medicare to determine if something might be a fraud case once you have contacted the provider and then something still doesn't seem quite right. And what they do with that information is they work with task force that operate with the CMS organization, the federal organization, to find Medicare fraud, and they track the reports and determine which ones seem to be the largest number, so they can track providers if they're getting quite a few calls on certain providers to determine if they can build a case on Medicare fraud from that. So it is very important that people report something that they think doesn't look quite right. You know, another example of fraud might be in hospital services. They had a case in Illinois to where a hospital had billed for lab services that weren't provided, and it got caught because they asked for a detailed billing, and it was like $16,000 of tests that were never received. So these are very, very important, examples of what is Medicare fraud, but that's certainly not all of the types of examples that can be found. There was a doctor that I believe that was prosecuted that was actually using his patients' Medicare numbers to bill them for services he never gave. They determined that there's no way he could have provided the types of services in the 24-hour time period that he was billing for, and he was caught. And what happens is they have to prosecute it. It's a long process, but they did get a conviction. So it's very, very important to be involved in this.
And I think what I'm hearing you say also in regards to fraud is that it's really important for us to kind of educate ourselves, because I think sometimes, even in the situation that you talked about in regards to the home care, somebody coming out from the doctor, the doctor sending someone out from home care to someone's home, I think oftentimes we're very trusting of what our doctors are doing, and we say, oh yeah, okay, that's fine. So I think some of it is really kind of educating ourselves and understanding what the services are and how some of those services are processed, and and even further, I think that you're exactly right, because we get that Medicare bill or any of those bills in the mail. They seem to be so big and so long and so much stuff to go through that sometimes I think it's one of those things that unfortunately gets put to the side because we just don't have the time or the energy to look through it at that moment in time. So I think this is such an important thing for us to really look at and really educate ourselves and others about this. And I do want to kind of talk a little bit about your volunteer program, but first, is there a way that we can protect ourselves from fraud?
Oh, absolutely. One of the first things that we tell people, and some of them really question it, is they should not carry their Medicare card in their wallet with them. A lot of people are very concerned about that because they're very upset about the idea that they were in an emergency, they wouldn't have their Medicare card with them, and they might ask for that. But the fact of the matter is I tell people that really, technically speaking, hospitals are required to trace whether you have your Medicare card on you or not. That information, just like any other insurance company, can be provided later, as it's necessary. So don't carry your Medicare card with you in your wallet. Now, sometimes you have to go to the doctor, and some doctors ask for that every time. I'm not quite sure why, because they usually have it in the records once they've made a copy of it. But some of them are that way, and so I do tell people they may need to, if they go to the doctor and they know they're going to have to get a copy of their Medicare card, put it in their wallet before they go and then take it out when they get home. But some people still don't feel comfortable with that, so in order to feel like they show that they have Medicare, I tell them, well, make a copy of your Medicare card, but black out with permanent marker the last 4 digits of your Social Security number, because that's your personal identifying number. And that way they can show that they have Medicare if they feel, you know, kind of bare without having something. And they can still do that as far as that particular program is concerned. And for keeping track for your summary statement, I always tell people too, the easiest way to go through your summary statement is to keep track of the services you received during the time you're doing it. And I find the simplest, easiest way of doing that is just using a calendar on the wall, the block type calendars that you can write in. And when you go to the doctor, write down that you went to the doctor, if you had any lab tests, if, you know, what types of services you received on the date. And that way, when your Medicare billing comes through, you can compare it to your summary statement to verify the dates of service, all of that. There is also a way, if people feel comfortable, but not all seniors do, and families sometimes can help with this, there is a way for them signing up on Medicare site, on Medicare.gov site, for what they call the My Medicare program, and they can actually view their summary statements in advance before they actually receive them in the mail. But the good thing about it is, and it is sensitive, it has a username and passphrase, so only they have access to the information. But what's good about it is when you put the arrow on the billing, the summary statement, it will drop down and give you more detail than you would actually even receive on your summary statement when it comes. So you can see exactly what services were provided, and perhaps in more detail if you're signed up on the mymedicare.gov program. But you do have to sign up for that, and sometimes a family member might be the source to do that if you don't feel comfortable doing it yourself. And it's an excellent way of keeping track of what you actually have been billed for. I might mention to you, one of the more significant fraud issues that, that's come up in the past is that the durable medical equipment, particularly electric wheelchairs, had gotten a lot of scrutiny now as far as Medicare is concerned, because first of all, it's a very high cost item, and secondly, you may have seen some of the advertisements of someone getting an electric wheelchair to go to the Grand Canyon, that type of thing, and it used to be that there was very little oversight on the electric wheelchairs, and that's why you saw so many ads, because they said Medicare would cover it. The trouble is Medicare is only supposed to cover electric wheelchairs for real medical necessity, and it's really mainly for people to get around in their homes. And we had a lot of people being sold electric wheelchairs they could not use in their homes because they didn't even go through their doctor. They had someone... I'm getting a snooze thing here.
We can still hear you. So
okay, good.
I think it's
good. All right. I just wanted to make sure I wasn't going out. Anyway, what was happening is they were billing Medicare because only about 5% of the claims were viewed. Well, that has changed in 7 states, and Illinois is one of them. They gradually have changed it where 100% of the electric wheelchairs are now being viewed, the claims, to verify that it was medically necessary. So I don't think you've seen many of those ads recently, because the companies have found out they can't get away with it like they used to. You know, I had one person who told me that they knew of a neighbor who had an electric wheelchair in their garage because it was so big. It was a very Cadillac model. They couldn't even get it in the house. Oh, no. So, you know, this is why it's important for people to use their own physicians to determine the real need for these things as well. And you can only get one electric wheelchair under Medicare. So if you got one that didn't work, you're out of luck in the future for one that you might need later on, per se.
You know, and it's funny because I was noticing just the other day, I thought, you know, I haven't seen many of those commercials lately. So so that kind of answers the question why I'm not seeing those commercials anymore.
Absolutely. They're not getting away with it like they used to.
Well, you know, and I think all of this information has been really great, because I think it's important for us to understand how we need to protect ourselves, how we can detect this information, and I love this information about being able to go to mymedicare.gov to be able to kind of look at this information a little bit more thoroughly, and maybe it's, if you're not comfortable of being online, I think it's a great way for maybe your family to help you with that, to look at it a little bit further. And then definitely reporting. Now, the 1-800 number that you gave to us earlier, that's a number that we can use to report fraud. Is that correct?
That's absolutely correct. Or if you're not sure if it's fraud or not, you could call that number as well. They would talk with you and tell you where they think it might be, something related to fraud. As I say, they keep track of all the calls that they receive too, and they do reports to the task forces. And of course, the task forces have priorities for as the programs they can get the most bang for their buck with as well too. So sometimes you may not hear back if you do call that number because the task forces are the ones that determine what they move forward to far as prosecutions and that type of thing.
Now, I just want to, if we could do one quick last thing. I know that you have this program, this Medicare Patrol program, that really is going out to educate people on Medicare fraud. And my biggest question is, because I do think that this is something that we really need to educate so many people about, how can people reach out to find out more about this program, maybe volunteer for this program, or bring that program to maybe their senior center, their church, or something of that nature? Can you tell us a little bit more about that?
Well, certainly. I represent a liaison for the county area that I mentioned previously for the Medicare Fraud program, and I'm the contact far as if they want presentations at their senior center, or they want me to come out or a volunteer to come out to talk a little bit more about Medicare fraud. You would call me at the Northeastern Illinois Agency on Aging, and that is 815-939-0727, and ask for Cheryl. And then if there's a volunteer in your area, I might send one of our volunteers who does presentations to your event, or if not, I would be coming to give that particular presentation. They can be anywhere from 20 minutes up to an hour. Usually I find there's lots of questions when we get to the end, so usually an hour. But it's an opportunity to ask questions about Medicare fraud. I have a lot of people that will tell me of circumstances that they now look back on and say it didn't seem right at the time, but now they recognize it for what it was, per se, too. And it's just an opportunity for seniors to be a part of this program as a volunteer. And it's a lot of fun. We do senior fairs, too, and give out information about the program. And so I have volunteers that some of them just go to the senior fairs, some of them do presentations as well. We work with the Senior Medicare Patrol program out of Age Options and have several programs that can be presented, and the programs are already scripted, so it's a matter of just being able to give a program and give the information out. We don't pretend to be the experts in Medicare. We let other people do that portion, but we are on fraud as far as these particular types of programs. And if we don't know the answer to those questions, we certainly we'll refer you on to Age Options to determine, what the circumstances are, concerning Medicare fraud as well too. But we're certainly welcome and open to getting contacts as far as doing programs and doing presentations out with groups out in the community.
Cheryl, I want to thank you so much for being on the show today. This has been some really great information. I think it's so important for us to understand how to protect ourselves, how to detect the fraud, and also how to report it. And what I'm going to do is I'm going to make sure that this 1-800 number is shared on my Facebook page, which is facebook.com/conversationsandcare. And I will also share the mymedicare.gov information as well, because I think that's a great option for us to, be able to check all that information, whenever the time is right, and maybe get a little bit more information in regards to what's happening on our bills. So thank you so much for joining us on Conversations in Care.
I enjoyed it, and I appreciate the opportunity. Everybody have a great day.
Thank you so much for joining us. Bye-bye.
Bye.